So the next question, Dr. Kumar, patients with 2 transplants and now a relapse, what is the next step forward?
So right now, I think with 2 relapses, we still have to use those combinations of different drugs. We talked about the proteasome inhibitors, the immunomodulatory drugs like the pomalidomide, Revlimid, and the monoclonal antibodies. So we have about a good portfolio of about 6 to 8 drugs that we can mix and match for those patients. Ideally, we would like to use something like a bispecific antibody or a CAR T in those patients, but they are not quite approved at that stage. And that's what I think, Aaron, your point about making sure we put patients on clinical trial comes in. And hopefully the clinical trials can actually give access to some of these newer therapies, even for those patients who just have had 2 relapses.
Yeah, and you know the labels better than me, but for the new fancy drugs, was it 4 or 5 lines of therapy, which, sometimes patients can be refractory to a lot of those drugs without having had that many lines. So unfortunately, that's what the label is. And at least in my case, insurance is sticking to that label, and it's hard to write for those drugs unless they've met that. Yeah.